Assalamu alaikum. My name is Hammad Majeed and I am going to present the drug addiction, and I am presenting to Dr. Hammad Majeed. First of all, what is drug addiction? Drug addiction is also called a substance use disorder. It is a disease that affects a person's brain and behavior, and it leads to an inability to control the use of a legal or illegal drug or medicine. And that doesn't mean drug is always harmful, it may be useful. Now let us discuss the types of the drug abuse, how a person can get abused. First of all, we are having the heroin. Heroin is a highly addictive opioid. It is obtained from the opium plant. Heroin is basically a substance. Using heroin can cause a person to experience seizures, psychosis, and hallucinations. Heroin, when it is injected, can also spread diseases such as human immunodeficiency virus and hepatitis. Next one is the cocaine. Cocaine, even when taken in small doses, it is very dangerous stimulant. It induces euphoria, increases blood pressure, and accelerates the heart rate. Next is the crack. Crack is also the form of cocaine. It is a potent form of cocaine that people smoke to create a short and intense euphoric sensation, having good sensation, feeling good, having happiness. Because of how inexpensive crack is, the abuse rates of crack are high. Next is the hallucinogens. First of all, we are having the compound that is called phencyclidine and LSD. LSD is the lysergic acid diethylamide are the hallucinogens. This means that these two substances make people feel, see, and hear things that are not real. Next is the amphetamines. Amphetamines are substances that are known for enhancing the ability of both the body and the mind as well. Unfortunately, amphetamines are also known for causing its user to experience manic periods of distress. These manic periods are usually accompanied by the extreme paranoia and inexplicable behavior and delusions. Next one is the marijuana. It is a type of drug abuse that are often the most common and are the ones that are the most accessible. This is a part of the reason why marijuana is the most common illegal drug abuse today. It is one of the illegal drugs that should be banned in Pakistan. Next is the alcohol. Alcohol is one of the other types of drug abuse that is common due to its accessibility. Abusing alcohol can cause psychological, physical, and social problems. It can also lead to the destruction of relationships, friendships, and marriages. Next is the inhalants. Inhalers are also the cause of the drug abuses. So the person who use the inhalers should be very careful while using the inhalers. It is preferable that you should use the saline inhalers instead of the inhalers which cause addiction. Inhalants are the substances that people breathe in through their noses to get high. Types of the drug abuse that are considered inhalants includes the abuse of the spray paint and the butane. So in order to avoid get addicted, you should use the inhalers which are not addictive, which should contain the saline solutions. Next is the prescription drugs. Prescription medication are the second most abused substances. Any medication the doctor can prescribe to patient is considered a prescription drug. This includes everything from depressant and anti-anxiety medication to sedative to even ADHD medications. Now we will see what stages are involved. The stages of drug addiction refers to the different phases that a person with a drug addiction may go through. These stages are characterized by different symptoms, behaviors, and consequences associated with the drug's use and addiction. Now, the duration of the stages of drug addiction can vary widely depending on the individual, the drug being used, and other factors as well. Now, if a person uses it for the first time, means initial use. The first step of the addiction is trying a substance. It is a trial. It is the first use. A person is using for the first time. It can be as fast as taking the first drink or smoking a cigarette. Next is the regular use. When a person becomes addicted, They become regular users, begin to show early signs of addiction. Sometimes they may use only on the weekends, but now also used in working days. Consider drug an important part of life, and they can never uh, forbidden it, and they can never live without the drugs then once they use it regularly. Next is the risky use. Drug use deepen, people may begin to show dangerous behaviors such as driving while drunk or high. The addiction of the drug affects one's ability to succeed at work or school. Relationship with friends or significant others may also begin to weak. Next is dependence. A person gets dependent on the drugs. The individual has developed a dependence to the substance and needs a dangerous amount of it to feel good again. It means a person get addicted to feel good again. If can't get them on time, cause effect on health such as muscle cramps, vomiting or fever. These are the factors, these are the effects. If a person doesn't get the drugs, who get addicted doesn't get the drugs at the time, then he may have such effects. Next, substance disorder use. Individual cannot perform daily activities without the use of drugs. They may lose their job, drop out of the school, and even face homelessness. They need proper treatment. Now we will discuss the risk factors. First is the family factor. Drug addiction in a family results from three factors: effect of pathological families on young people's behavior, easy access to drugs, influence of group of people of the same age, so a company matters, and it is common in the age of 16 to 18. Drug addiction came mostly from incomplete and pathological families. Individual risk factor may also happen. The individual risk factor identified were traits of high impulsivity, rebelliousness, emotional regulation impairment, pain, catastrophic, total screen time, and alexithymia. Physiosocial factors. Relapse to drug use after successful treatment and rehabilitation is a common problem globally. The negative emotion factor had strong contribution on relapse, while peer pressure, self-efficacy, and lack of assertiveness contributed to relapse moderately. The parental discord in relation with parent factors showed no relationship with relapse. Now, stress. The neuropeptide corticotrophin releasing factor and related neuropeptide not only mediate hormonal responses to stressors but also have the neurotropic role in the central nervous system to mediate behavioral responses to stressors. Following are the stressors: CRF1, CRF2, urocortin. Now, mental health issues due to the drug addiction. What are the mental health issues due to the drug addiction? How the mental health can be affected if a person get addicted? Patients with disorders due to the drug use might have mental or physical health comorbidities or both. Mental health condition can be a direct consequence of substance intoxication or withdrawal. Depression is the first step or the first form. Depression is the mood disorder that causes a persistent feeling of sadness, worthlessness, and loss of interest, also called major depressive disorder. It affects how you feel, think, and behave. Next is the anxiety. Anxiety is a feeling of fear, dread, and uneasiness. It can be a normal reaction to stress. Anxiety is common, but it rises to the level of a disorder when it interferes in everyday life, like OCD and panic disorder. Next is the attention deficit hyperactivity disorders. ADHD is diagnosed when a person has difficulty concentrating, paying attention, sitting still, following directions, and controlling impulsive behavior. Symptoms include inattentiveness, difficulty concentrating and focusing, hyperactivity, and impulsiveness. The person is not in his senses, in short, we can say. Next is the bipolar disorder. Bipolar disorder, also known as manic depression, it is a mental illness that brings severe high and low moods and changes in sleep, energy, thinking, and behavior. People with bipolar disorder have episodes of depression, feeling very low and lethargic, sometimes feeling good, sometimes feeling low, mania, feeling very high and overactive. It gets phenomenal. Next is schizophrenia. Schizophrenia is a disorder characterized by distorted perceptions of reality. and disorganized thinking and speech characterized by delusions, hallucinations, or disorganized speech. Borderline personality disorder. Borderline personality disorder is a mental health condition marked by extreme mood fluctuations in stability in interpersonal relationships, and impulsivity. People with borderline personality disorder have an intense fear of abandonment and have trouble regulating their emotions, especially anger. They also tend to show impulsive and dangerous behaviors. Next is physical problems induced by drug addiction, infection, and immune system damage. Due to the drug addiction, following physical problems can happen. Infection first is the infection and immune system damage. Drugs that are injected intravenously carry a very high risk of infection, especially from HIV, hepatitis B and C, because the syringes for injecting intravenously, they may or may not be hygienic, or bacterial infection from sharing dirty needles. Some drugs like cocaine reduces immune response to infection. So in this way immune system get damaged. Next is the cardiovascular problem. Stimulants can increase the user's heart rate, while CNS central nervous system depressants can slow it down. Consistent higher low blood pressure may be associated with an increased risk of blood clot, ischemic injury, overdose lead to death from cardiac arrest. Next is the gastrointestinal issues due to the drugs. Gastrointestinal issues can happen. Drugs that are ingested orally, such as alcohol or prescription drugs like opioids or ADHD. One of the opioid we have discussed, that is the heroin or cocaine. A ADHD medication can cause harm to the digestive system, include such as the mesenteric atrial vasospasm, reflux, esophagitis, increased gastrointestinal cancer risk even. Next is the respiratory problem. Smoking any drug can damage alveoli in the lungs and make the upper respiratory system more susceptible to infections. If a person overdoses and opioids, CNS depressant, hypoxia can lead to death. Next is the liver damage, the primary site of detoxification for many type of consumed substances. In the face of constantly high level of certain drugs, the liver can become overwhelmed in its metabolic duties, and the tissues of the organ begin to break down, causing cirrhosis or hepatitis. So liver can damage in this way. Next is the kidney damage. The kidneys also filter toxins out of the bloodstream, so they are affected by the large amount of any dangerous substance in the blood. Some drugs are associated with a condition known as rhabdomyolysis, breakdown of muscle tissue, leading up to the renal failure that require dialysis. Next, treatment of drug addiction. How a drug addictor can be treated. How drug addiction can be treated. Drug addiction is a chronic disease which is difficult to treat, but it is recoverable and requires ongoing care. Every person's experience is different, and there is no consensus on what exactly constitutes early recovery. Some groups consider it the first 90 days after getting clean, other up to 6 months or even a year. In the life of the drug addiction, it helps the drug addictor to get rid of the drugs. So rehabilitation center organize different physical and mental activities for the drug addictor, and have different exercises for the drug addictors to leave this habit. Drug users to make their life easy and change their lifestyle. It is a kind of process of human transformation. So rehabilitation centers should be available for the drug addictors. Next is a family support. A drug addictor can get rid of the drug addiction if the family support him, for example by sharing the problems, open discussion with adolescent, parental monitoring, and parental involvement in school activities. Next is a motivational interviewing. It is a counseling approach that helps the individual to enhance the motivation for change by following the ways: active listening, express empathy, Open questions and summarize and recap sessions. Behavioral counseling. Behavioral therapies can help to motivate people to participate in drug treatment, offer strategies for coping with the drug cravings, and teach ways to avoid drugs. The therapists help the person to identify how bad thoughts contribute to self destructive behaviors. Once the patterns are known, the therapist works with the person to think more constructively and help him to get rid of this situation. Physical exercise. Physical activity releases feel good endorphins in the brain and improves circulation, both of which help with the stress. So, it is also a good way to get rid of. Exercise can help manage stress, depression, and anxiety, which can all contribute to substance use. Thank you so much.